Most people think sepsis is something that only happens in intensive care units or after major surgery. That's dangerously wrong. A perfectly healthy person can wake up with what feels like a mild flu and be fighting for their life by nightfall. Every single year, sepsis kills more people worldwide than breast cancer, bowel cancer, and prostate cancer combined. More than 11 million lives are lost annually. That's roughly one death every few seconds from a condition many people still couldn't explain if you asked them today. And here's the terrifying part. Most victims didn't realize how serious it was until it was already critical, because sepsis doesn't usually start looking deadly. It starts looking ordinary: a sore throat, food poisoning, a chest infection, a cut that seemed harmless. Then suddenly, everything changes. The body begins shutting down. Blood pressure crashes. Organs stop getting oxygen. Confusion sets in. Breathing becomes difficult. And in severe cases, death can happen within hours. By the end of this video, you'll know the warning signs doctors never ignore, why sepsis is so often missed, and the simple question that could one day save your life or someone you love. Because once you understand how sepsis really works, you will never look at an infection the same way again. So what exactly is sepsis? Sepsis is not the infection itself. It's your body's extreme reaction to an infection. Normally, your immune system acts like a highly trained defense force. It identifies harmful invaders like bacteria, viruses, or fungi and attacks them with precision. Most of the time, that system works incredibly well. But in sepsis, the immune system essentially loses control. Instead of attacking only the infection, it launches a massive inflammatory response throughout the entire body. Blood vessels begin leaking. Tiny clots form. Blood pressure drops dangerously low. And vital organs like the brain, kidneys, lungs, and heart stop receiving the oxygen they need. In other words, the body starts attacking itself. That's why sepsis is so deadly. Not because the infection is always severe, but because the body's response becomes catastrophic. And if it progresses into septic shock, survival chances drop dramatically. Even with treatment, septic shock kills a huge percentage of patients. What makes this even more dangerous is how fast it can happen. Imagine this: you wake up feeling exhausted. Your muscles ache. Maybe you have a fever or chills. You assume it's just a virus and decide to sleep it off. A few hours later, your breathing feels strange. Your heart is racing. You're shaking uncontrollably. You try to stand up but feel dizzy and weak. Suddenly, simple sentences become hard to form. That rapid downward spiral is one of the biggest warning signs of sepsis. And yet millions of people miss it because the early symptoms seem so normal. This is exactly why doctors fear sepsis so much, not because it's rare. Because it hides in plain sight. Sepsis can affect anyone. Children, athletes, pregnant women, elderly adults. Healthy people with no medical history at all. It can begin with pneumonia, a urinary tract infection, food poisoning, an infected wound, or even something as small as a blister. There are documented cases where people ignored what seemed like minor symptoms in the morning and were in intensive care before the day was over. That's the speed we're talking about. And survivors often describe the experience in chillingly similar ways. They say they felt an overwhelming sense that something was deeply wrong long before doctors confirmed it. That feeling matters more than most people realize, because one of the most important tools for surviving sepsis is recognizing it early. Doctors often use a simple memory tool to help identify the danger signs. It spells the word sepsis as slurred speech or sudden confusion. E, extreme shivering, severe muscle pain or fever. P, passing little or no urine. S, severe breathlessness. I feel like I might die. That intense sense that something is horribly wrong. And the final S, skin becoming mottled, pale, bluish, or discolored. If someone with an infection develops these symptoms, do not wait to see if things improve. That delay can be fatal. Sepsis is a true medical emergency, just like a stroke or heart attack. The difference is that many people don't recognize it until valuable time has already been lost. And time matters enormously. In hospitals, there's a reason medical teams move so aggressively once sepsis is suspected. Every hour without treatment significantly increases the risk of death. That's why doctors often begin a rapid treatment process known as the sepsis 6. They give high-flow oxygen. Take blood cultures to identify the infection. Start powerful intravenous antibiotics. Measure blood lactate levels to assess organ stress. Give IV fluids to support blood pressure. And closely monitor urine output. These interventions sound simple, but when started quickly, they save lives, especially within the first hour. The challenge is that sepsis is a master of disguise. Early on, it can look almost identical to flu, gastroenteritis, pneumonia, exhaustion, or even dehydration. That's one reason it continues to kill so many people worldwide despite modern medicine. Many patients don't seek help soon enough because they underestimate the symptoms. And sometimes even healthcare professionals may not immediately recognize how quickly things are escalating. Some people are also at much higher risk. Newborn babies and young children are especially vulnerable because their immune systems are still developing. Older adults face higher danger because immune responses weaken with age. Pregnant women undergo major immune and hormonal changes that can increase susceptibility. And people living with conditions like diabetes, cancer, kidney disease, lung disease, or weakened immune systems face a significantly higher risk as well. But here's something many people don't realize. Even surviving sepsis doesn't always mean life returns to normal. For many survivors, the battle continues long after they leave the hospital. There's a condition known as post-sepsis syndrome, and it can be devastating. People report crushing fatigue, memory problems, nightmares, anxiety, depression, muscle weakness, chronic pain, and difficulty concentrating for months or even years afterward. Some say it felt like aging decades in just a few weeks. Others never fully regain their previous health. Studies have shown survivors can face increased risks of future heart disease, kidney problems, and mental health struggles. Families are affected too. Watching someone deteriorate rapidly from sepsis can leave emotional scars that last for years. And globally, the problem is becoming even more complicated. In many low-resource regions, limited access to clean water, healthcare, and antibiotics allows infections to become deadly far more easily. Meanwhile, in wealthier countries, antibiotic resistance is creating a new threat as some bacteria become harder and harder to treat. So what should you do if you suspect sepsis? First, trust sudden severe symptoms, especially when there's an infection involved. Second, remember the warning signs we covered earlier. Third, act immediately. Not tomorrow, not after seeing how things go overnight. Immediately, call emergency services or seek urgent medical care. And if you're already in a clinic or hospital, say the word clearly. I'm worried about sepsis. That single sentence can accelerate assessment and treatment faster than you might imagine. You can also reduce your risk by preventing infections in the first place. Stay up to date with vaccinations. Practice good hand hygiene. Treat wounds properly. Seek medical advice if an infection suddenly worsens. And manage chronic